Good morning, everybody, and thank you for joining us for this week's session of Aging Strong. And now I would like to introduce our presenter for today, Debbie Lynn Toomey. Thank you so much for joining us. She is a coordinator at Tufts Medical Center Injury Prevention. Debbie, thank you.
Thank you so much, Carrie. And again, thank you to the Quincy Public Library for allowing me to continue to do my outreach injury prevention work in this manner. I'm just very, very grateful to be able to do it in this respect. So today I have two guest speakers, and they are from Oakley Home Access. And I want to introduce you to Norma Morata and also Dan Lynch. Thank you, Norma. Thank you, Dan, for being here. I can't wait to learn about what you offer and also how the aging population can benefit from the information that you're going to be sharing with us today. So, Norma, Dan, take it away.
All right, absolutely.
Thank you. Dan, do you want to start? Would you like me to start?
No, I guess I'll bring up the PowerPoint for everybody, give everyone a visual. And then I think I can start to walk people through a little bit. And how do you guys feel about that?
Yeah, that sounds great. Actually, Dan, while you're pulling up the presentation, Norma, can you just share with us what it is that you do for Oakley Home Access? What's your role?
Sure, absolutely. My role with Oakley Home Access is to reach out and connect with professionals such as Debbie, who works in the field of injury prevention, and other healthcare providers and different people in areas who might work with an older or mobility impaired population to educate them about the types of home modifications and adaptive equipment that is available to allow people to age in place more safely and with the proper supports to make their home accessible, reduce the risk of falls, allow them to use their own home with the best quality of life possible. Dan is one of the occupational therapists who works for Oakley Home Access and provides the free, no obligation home safety assessment that we offer to everyone in Rhode Island, Massachusetts, and even some parts of Connecticut. So he has a presentation today that's going to speak about some of the needs that we see out in the community, how we're able to make recommendations to provide the proper equipment or home modifications or even just general things that someone can do around their home on their own. I'm sure he'll talk about better lighting, removing objects that may restrict access or areas of your home that have clutter or objects that could be in the way, as well as the other types of things that we do, professional level modifications and equipment that people may want to ask questions about, what's needed in their home, depending on their diagnosis and plans for aging in place. The company was started by an OT and a licensed contractor who are passionate about helping people age in place. So our goal is to support that whenever it's possible to provide what someone needs in order to stay in their own home safely and comfortably. We're happy to answer any questions during the in-service. Feel free to raise your hand visually or in the chat or let the moderators know. And of course, we'll have question and answers at the end.
Great, thank you. So Dan, are you ready to do your presentation?
Yeah, I'm definitely ready. Thank you, Norma, for that introduction. And thanks, Deb, and everybody for joining us. So I just want to let you know that I'm an occupational therapist working at Oakley Home Access. And I specialize in going to homes and looking for areas that could cause falls or could be potential hazards. So I want to start the presentation to give us a brief history of Oakley Home Access. So we were founded in 2015 by Justin Oakley, who, like myself, is an occupational therapist. When he was working in a skilled nursing facility, he was continually seeing people who would always come back to the facility with multiple falls. Justin would make recommendations for grab bars and seating, custom seating for people who, when they go home, they can be much safer. And what he was finding is that the individuals would be coming back to him with similar falls and also with none of the equipment that he recommended. For Justin, who cared about so much about protecting people and his heart as an occupational therapist is in helping the individual and making them safer within their own home. So what spurred this is one grab bar for Justin, which is the grab bar to help somebody get in and out of the tub. So what Justin needed was somebody who could simply help him out with putting the modifications in the homes. Fortunately for Justin, he had Mike Vieira, who was a longtime friend and contractor. Mike has a background in home improvement, and also he was a surf buddy of Justin. So they had a really good rapport together. So together, they decided they had a shared passion to take care of people and prevent falls in the home.
And can I just ask you a quick question?
Yes.
The term age in place,
Yes.
that's becoming very popular. And I just want to, can you just explain to people who are watching what age in place means? So that way they have an idea of what that terminology is.
It simply means you staying home where you live in your home to make small changes. So the ability to stay in your home and live every day like you normally do, and make simple, small changes along the way. Sometimes it's just access into the home, putting railings where the stairs are, grab bars in distinct locations. So you can live in your home for multiple years and not have to think about the home that you love. I have to move out because it's no longer fitting for me, even though you've had so many years of family gatherings. You have so much history there. For the longest time, people had no other choice but to make that decision to move out. But now, because of resources that we have through the ADA, accessibility companies like ourselves, you don't have to make that decision.
What type of home modification are typically needed for people, not just the elderly population, but people maybe who are people who may have suffered strokes or any type of amputation? What type of devices or suggestions do you normally give to these people?
I'll volunteer that I don't think there's anyone who would not like having some extra grab bars in their bathroom or bathtub. Specifically, if you have a traditional bathtub, where else in your life do you need to step over, an 18 to 20 inch wall? Not really too many places. So that hazard of that extra physical reach combined with it being wet and slippery is something that I think everybody, regardless of their age, has had that one little close call where they go to grab for something and there's nothing there, or they grab the towel rack and it comes right off the wall, or something like that. The bathroom is considered the most dangerous place in the house because of the fall risk. I don't think it's a bad idea for anybody at any age to consider having at least one supplemental grab bar somewhere right outside their bathtub or shower, just to be able to grab that if they do take a sudden little slip. So we do see a lot of that, and I don't think that's that's kind of the universal, and that is often the thing that people call for first.
What is home modification, and what would that look like in their home?
Railing systems, ramps, as I mentioned before, some stair lifts as well to get you past into the home, vertical platform lifts. The main event for most OTs is in the bathroom. So just like Norma said, grab bars, really, really good place to put them is right that tub wall. Nowhere in life are you going to step over a wall that high other than in your tub. Things like seating choices, just having a tub bench to sit and swivel and slide over. If you want to use your tub just like you normally would, sometimes just one grab bar is good enough to help you get over that wall and just give you your confidence back. Sometimes it doesn't have to be a fall. to trigger, hey, I need a grab bar. And it shouldn't be. It really shouldn't be. It should be just realizing that you want to feel safe, and you shouldn't have that feeling that, it's one of the most important things that you do every day, part of your routine, a shower, is going to create any anxiety. If you sometimes just one grab bar will give you that confidence back and will prevent a fall. Other items like floor to ceiling poles are really helpful for people coming out of the tub.
I used to work in the rehab department, and the pictures that you have here, it reminds me of my days when I used to take care of patients who were in rehab. And it's just incredible how technology or services has advanced so that people who are maybe in rehab and are going home, it's great how there's so many different types of devices that can make it so much easier for them to live independently, maybe, or with minimal assistance in the comforts of their own home. So that's just something I wanted to kind of offer. It's really incredible. So
I can say, Debbie and our audience here, that something that often comes up when a person calls and starts to ask about having the home assessment because their PT or nurse or someone has said this might be a good idea, something for you to look into proactively. It's, I don't want my house to look like a nursing home. And we know you don't either. It is your home first and foremost, and you want it to remain your home for as long as possible. So from a decorator's point of view, yes, you can see even just in a couple of photos here, there are different options that may blend better with your existing bathroom. When physical mobility becomes a point that certain other equipment may be needed to help you stay in your home, yeah, it's not always the prettiest thing, but most of the time it can be tucked out of the way and only used when you and your caregiver need to use it. But as I said, a guest who's using your bathroom and notices the grab bar might say, it's really handy to have this here when I'm going to raise myself up from a seated position. And I didn't realize that I even had any difficulty until I had help with it. So we do try to keep it very blended into the existing home. And that's the goal of anyone now who does home modifications and equipment, for people to be happy in their home, but also to be safe, but still make it feel like home.
Sure. Yeah. I mean, I'm sure there are different stages of home modification. My husband had a total knee surgery, and he needed certain equipments in the bathroom, in toilet, and also the shower to make sure that he was recovering and healing the best possible way and comfortably at home. So, some of those equipments we had just temporarily. So, so that's one spectrum. And then another spectrum where you do need to make, changes. But, I'm sure that once the individual starts utilizing and using all these different equipments, they'll see how important it is to continue and have them be able to do what they need to do in a comfortable way.
And on that topic, as you mentioned, sometimes it is a temporary need while someone is recovering, like my ruptured Achilles friend, who's happy that she has it and will keep it. Other times when someone is newly diagnosed or in the early stages of something that's going to be progressive, Parkinson's or ALS or something else that's neurological, they are doing all the therapy and doing everything they can to slow the progression and maintain and even sometimes make progress. But they also want to plan ahead for, what about in 2 or 3 years? What might I need in place then to stay home? So working with somebody on a continuum is another good thing to think about when you are considering home modifications. If there's something urgent or that would be helpful now, but what might you be looking at 10 years in the future, even if right now all you're worried about is arthritis or a balance problem that you're working on with PT, moving forward and making sure that your home stays on track with what you need is the goal that a lot of people have.
Yeah,
yep,
definitely.
Absolutely. And some of the things that you never think about is nobody ever expects disability in their life. Nobody says, nobody plans for their next fall or anything like that. I think that's what the difficulty with everybody, even myself. You don't expect, you think every day is just gonna come to you and it's gonna go very smoothly, and you keep kicking that down the road that you wouldn't need this. And I'm starting to see a change in a lot of people. Just as an occupational therapist, I think people are becoming more educated, and people are going for these conservative options and getting grab bars and saying, whether it be an experience that they've learned from a loved one or another individual, to just give them the push to look around and just have somebody look around and check out their house, or even make modifications for themselves, or buy a tub seat or a tub bench. Just small little changes to their bathroom or home that can make them just feel safer.
As far as homes, are there any type of homes that absolutely cannot have any type of drastic home modification? I'm thinking homes that's 100 years old and maybe may fall in the historic homes.
I don't know about legally, but I do know that occasionally, and here in New England, in all the states that Oakley works in for sure, and outside, there are lots of older homes, lots who have a historic designation, but, a lot who were built 1800s when things were a lot different. People certainly weren't living necessarily into their 80s and 90s and remaining at home then. So I know there have been occasions where we have gone out to see a home that is a lot older. And the staircases that go from the first to the second floor, if you've ever been in any of these in any of these homes, like the House of Seven Gables, or any of the ones that have been turned into museums, the staircases are often very narrow. The rise between stairs is higher than what we're used to in current day construction, and the actual part where your foot sits as you're walking up or down the stairs is smaller, and they're often very curved, almost a spiral or a very tight C shape if they were open. So a staircase like that is something that generally there is no stair lift. So the pictures that we have up right now, none of these could be configured to fit in a home like that. And that's usually the situation where the person then may have to think about modifying or creating a bathroom on the first floor of their home, or unfortunately sometimes at that point it does become necessary for a person to move and relocate either to an accessible apartment, to a family member. Just because of the construction of the home, there's often no way, even for an architect or carpenter, to take out those stairs and make something straight or wider. It would probably be more work than it's worth for that person. So as far as historical designations, Debbie, I know we did a outside ramp for a business in New Bedford whose office building is historic. They did have to notify the commission or overseers that they needed this ramp to make their building ADA compliant, and I believe that trumps any historic restrictions on it. With a home, I know we have worked with some down in the Newport area of Rhode Island where there does have to be some communications about what the person's doing, even if it's interior work. So that's a stumbling block that comes up sometimes. There's often an accessible way around it. Rarely there is not, though. But good to keep in mind if someone lives in an older home. And if anyone is a renter, I don't think there's much that can be, a landlord cannot refuse to let you have adaptive equipment or modifications done if it's needed. So
it's Norma, it's almost like Deb followed me around in my assessments yesterday, because I had a lot of historical homes for home modifications yesterday. And what I can add to that is sometimes that's where the collaboration with the client really, really matters the most, is finding out what the family member wants and what they're willing to sacrifice, or sometimes it might be the first floor living. Yesterday I was able to find a solution where they had a very narrow staircase. They wanted to maintain the sanctity of the home. the mother who was in the hospital would not want her daughter to alter the home in any way. Fortunately, we looked around a little bit, and there was an outside staircase that we were able to assess as a good candidate for an outdoor stair lift. So in that area we just had an outdoor stair lift to go into the home, preserving the sanctity of the home, and very minimally invasive as well.
That's great. Is there I'm looking at the chair lifts. Is
Mhm.
there a weight limitation? Is there like a maximum amount of weight? And I'm sure depending on the client, you'd basically figure out the best, most comfortable seat for that particular person, right?
Absolutely. So when we look at the assessment, one of the most important things that we look at, and this is tagged in ours, but we look at the height and weight, because that matters a lot for stair lifts. There's many different adaptations and variations to the stair lift, and that's why it's important to know the individual and fit them with the right equipment that can be safe for them.
Yes, definitely.
So I'll just add there, Debbie, that a lot of other types of equipment does come in bariatric options now, whether it's a sliding shower seat or raised recliner and things like that, because there is a need for it. So vendors and manufacturers are responding to that, making it able for companies like us to offer that for people whose needs are over the typical models.
Very good. That's good. So I think one of your slides was on funding. I'm curious to see, what type of information do you have about funding? Because all of these modifications, they seem a bit expensive.
Yeah, some of them are. So I'll handle this uncomfortable subject, which is often after somebody calls and says, here's where I live and here's what I think I might need. When can you come out? The next question is, does Medicare pay for any of this? Unfortunately, Medicare does not. I hope that someday there's the overhaul in the medical and health insurance system that we all want, because an ounce of prevention is really worth a pound of cure when it comes to home safety and fall prevention. But right now the system is not quite on board with that. The slide only reflects what's available in Rhode Island at this time, but we are happy to report that right now in the Massachusetts legislature, there is a livable home modification grant for Massachusetts that will be presented to your state representatives in this upcoming session, and we hope very much that will pass. It's used very frequently and with very little red tape in Rhode Island, and it helps a lot of people there get a tax-free grant that will help them pay for home modifications when they meet certain criteria. There is very little in the way of any private or public health insurance that will necessarily pay for what we do, unfortunately, or what anybody in this field does. Of course, there are things you can get through Medicare if you're homebound and your doctor orders them for you and a visiting nurse association handles that. But when somebody wants to make this choice on their own, we are a provided contractor with the Massachusetts Rehabilitation Commission, as are many other companies who do the same kind of work that we do. So when somebody's in their system and needs home modifications, their goal is to help that person obtain them. Often elder services in York County, I believe it's South Shore Elder Services that covers Quincy and that part of Norfolk County, will have funding available even for folks who are not enrolled with elder services. They often have stipends or grants, or sometimes they call them scholarships. Old Colony Elder Services calls them that, which they can offer to people when something is urgently needed to help pay for it. Long-term care insurance, although I don't think we run into a huge number of people who have long-term care policy, often through Genworth or MetLife, actually does pay for what we do, because they are a for-profit company who has seen the value in spending a little money to prevent their subscriber from having that accident at home and preventing that fall, that ambulance ride, that surgery, that rehab stay, ongoing care. They would much rather pay for a few $100s worth of grab bars. They have actually the Long-Term Care Insurance Board. I've spoken with somebody who's on it. They have calculated that an expenditure of $150 of home modifications potentially saves them $150,000 payout to the subscriber. So they are proactive in helping their members get what they need, and preventing the longer sustained problems that they'd have to pay for years to come. The VA is often a good outlet for anybody who was, or has a spouse who is or was a veteran. And every town and city in Massachusetts has a VA liaison in your town hall or city hall, which is a great place to start asking questions. And there are also a lot of national and local organizations, the ALS Association, certain towns and cities, you'll find that the housing department will have funding to help pay for things like this. You got to do work. The best place to start, in my opinion, for anyone in Massachusetts is with their local Center for Independent Living. There are 10 of them in Massachusetts. If you Google Massachusetts Centers for Independent Living, and there's a list of towns and cities, or you type in your town and city, it will tell you which one covers your area. And a quick phone call to them will get you right to a social worker who is going to be the expert on different grants and funds and availability that is specific to your area and throughout Massachusetts.
Yeah, that's very good. I'm glad you mentioned that, because it just seems that there's just a lot of money on the table that could be used if
that's
people,
absolutely true.
Yeah,
it's there's, you're not going to see a commercial on TV during the day telling you like, hey, could you really use a ramp at home, or is your bathroom making you feel unsafe? Here's a grant that you can get. You're not going to see that. You really have to, unfortunately, look for it, or know somebody like us who's going to help you look for it and locate what you need. But your town or city hall, housing department, local commission on disabilities, local elder services, local council on aging, or your VA liaison is the best starting point, in addition to your Center for Independent Living.
Definitely. That's why I was really excited to have you and Dan on this program, because the more the aging population knows about the resources out there, that's going to help their lives so much more, enhance, and, just more comfortable. I keep saying the word comfortable, but, it's, we have to be able to age in place in a home where we feel safe, where we can move around comfortably and be able to just, explore different areas of the room whenever we want, if we can. Really doing your homework, and like you said, getting to know the services out there. Call, even if you don't need these services right now, but just knowing the players, who the stakeholders are, and getting to know what they offer in the different cities and towns that you might live in, so that, heaven forbid, maybe you, a family member, or friends may need this type of services, you'll be able to give them the best advice that's going to save them a lot of money.
Absolutely. And, we're here to educate about what's available, but also how people would get to it. And I wish it were as easy as somebody showing their Medicare card and saying, my doctor says I need this, the same way they write a prescription for a medication or for physical therapy. And I do hope that someday things are reconfigured, to be a little bit more proactive and to preventing the hospitalization, the fall, the surgery in the first place. In the meantime, though, knowing as much as you can, and we welcome questions, even if you're not calling us to do any work for you. Always happy to help people find what's available in their area, or answer general questions about equipment and funding. And I'm sure that Debbie and the Quincy Public Library can share contact information for me if that's appropriate.
Yeah. I was thinking this morning about this program and how home modification, in a way, is similar to when for young parents who have toddlers, how they put those gates on the stairs, and how they do the little safety things for the corner of the furniture so nobody gets hurt. So in a way, this is in the other spectrum of the age. spectrum. This is what we are up against as we get, older and older, because the population is living, to an age of 85 and up now, right?
Absolutely. And another concern or question that we see, and that you may see also in your little universe of your own, Debbie, there's special considerations that come for home safety when one of the persons living in the home is memory impaired or has dementia. There's often changes in the way they see things visually, as far as depth perception, so stairs, thresholds. Sometimes people have like that one step up from their deck into the main living area of the home. So without a professional insight to that, you can certainly find ideas about using reflective tape or neon tape or something that's going to help them keep their bearings about them, maybe, for lack of a better term. Outside of the physical things that we all think of about balance, somebody who has orthopedic or neurological issues, the changes that can come with dementia or memory care diagnosis, but the person's still able to live at home. You may need to label things, lock cabinets, and this is an ongoing situation that can be a lot more difficult than just keeping things visual. But the fall risk is increased with the memory care issue, and so there are some simple, more visually effective ways to outfit a home for somebody who has that diagnosis and is living at home with others, but still ambulating about and going about their own routine.
Absolutely. And Debbie, you brought up a very interesting parallel with the getting a child and having the putting everything on the corners and these little things that you do. What do people do before they know they're going to have a child? They outfit that home way before time's there. You can go to multiple stores and you have multiple safety kits for toddlers and individuals, and we care so much about the safety, and we have so much foresight when it's a toddler or a different child. And I think the group think with adults should be the same, more of preventative, and everything you mentioned was small changes, right? Baby gate, certain things, and we would do the same thing for somebody who's aging in place. If you're preventative with it, it's small changes. If something catastrophic happens, then we have to look more into things like the funding sources and larger ticket items. So that's why I really enjoy something like this, where we have an audience to just educate and, preach the safety and preventative care. Because, just not our loved ones, everybody, we're all aging, everybody's getting older. We all have to think about these things to make lives better for everybody.
Right.
I want to also step back a second, if I can, Debbie, before we ask for questions about funding and about temporary situations. People listening in or watching this later should know that often places like the Lions Club, the Elks, your public health department, nurses in your city or town often have loaner equipment for somebody who's, recovering from a surgery. They're just going to need to use a wheelchair for a couple of months or a walker. So smaller, home type equipment that you might see at a DME store, at a drugstore that does a lot of surgical supplies. They often have a lending library of some of those items that people can borrow at no charge for as long as they leave it. And those organizations keep it clean and maintained and ready to be loaned to somebody else the next time they need it. So people always worry, like, am I going to have to go out and buy all these things? Just, he's going to be fine in 3 months, but we need this in the meantime. There are often opportunities to find equipment that is safe and appropriate and looked at by somebody in the healthcare profession, so they know it's okay for that person to use, and then they let you sign it out for as long as you need to use it.
Yeah, very good point. I'm glad you mentioned that. There is a place in Quincy that when people are done with their walkers or their crutches or, toilet seats, canes, they will just donate it to that facility, and that facility is open to the public, and the people can just go and look at what they need, take it, while they, and use it for the amount of time that they need it, and then just return it. So it's really a lovely way to recycle and take care of each other. So question about, when people are in rehab. And so let's say a person could be had a stroke and they are mentally intact, but they suffered paralysis. Now, when they go home, is there a way for that particular, say if that person wants to stay at home and they have a 2-family home, is there any type of referrals from physical therapy, from OT to to companies like Oakley, or is it up to the individual to really advocate for themselves and do the homework once they're home to try to figure out how they can make their home work for them?
We try to be as present and available to and visible to the rehab staff and discharge planning staff at hospitals and rehabs for that reason, Debbie, so that this planning can start before the person is ready to discharge, perhaps have the equipment in place if needed before the person comes home, and make the safest discharge plan possible to prevent another readmission or any kind of an accident at home. So we are always attending meetings, reaching out to all the hospitals here in the New England area, and we're fortunate to have some of the best long-term acute care hospitals as well as all the short-term rehabs, so that those care providers who are trying to plan to get this person home, what might they need, they know that there are resources available. It's much to everyone's benefit, as always, to be as proactive as they can with this. Sometimes it's as simple as them mentioning, what does your house look like? How are you going to get around? And sometimes it doesn't happen until the person is home and visiting nurse, visiting PT and OT are coming to treat the patient at home to continue with their recovery.
A few programs ago, we had somebody, a physical therapist, and he and his colleague talked about different exercises that people can do at home. Mm-hmm. What's the difference between a physical therapist and occupational therapist? I know as a nurse working in the hospital, I usually see OT and PT, they work hand in hand together to help the person, be able to be discharged safely. So what's the difference between the two?
I love that question. Yes. So OT and PT, we often work very closely together. The differences would be that the occupational therapist more often would address things in the bathroom, tub transfers, bathing, dressing routines. Physical therapists, even though we both can cross over a little bit and we collaborate on a lot of these different things, physical therapists often focus a bit more on access to the home. So stairs, ambulation, walking, using the appropriate assistive device. But I think that the biggest thing is that occupational therapists, we focus a bit more, we call the bathroom the main event, so to speak, because that's the area where we really specialize in. But we definitely do collaborate with a physical therapist on a lot of different areas as well. So a little bit of crossover, but yes, there's definitely a little bit of distinction.
And why do you think a lot of falls happen in the bathroom? Because, just reading the statistics, the bathroom is one of the most common place for the aging population to kind of fall.
Yep.
Why is that?
Absolutely. So it has a lot to do with the environment you're in. You have a lot of slippery surfaces. There's not a lot of places to hold. It's a dynamic area. Water, water on tile is very slippery. And then one of the biggest thing is right behind me, which is the tub wall. You can almost see it. That wall, especially without a grab bar there, trying to step over sometimes a 20-inch wall with somebody who already has balance deficits, that can be catastrophic. That can be difficult for anybody. Additionally, people really, they push for autonomy. One of the biggest places they want to be autonomous is the bathroom. And there's a modesty feature too, because if somebody might ask for help in the kitchen or might ask for help to get into bed. But when it comes to the bathroom, they might take that risk. So they're taking a higher risk in a riskier area. So I think that's one of the areas where we like to look at the most because it does have an increased risk for falls and unfortunately catastrophic falls. So
Yeah, definitely. It's, you know what? A lot of falls happen in the hospital bathrooms as well. And
yes,
it's really it's a tricky thing because,
Mhm.
you know, nurses aid, they want to be respectful of the
Yep.
patient. And depending on the culture too, depending on the age, the sex of either, the care provider or the patient, there, privacy needs to happen. But you know what? There's a lot of falls that happen in the bathroom and the hospital, even though there are
Absolutely.
people right there and then,
yeah,
so it's just so important to make sure that the bathroom is as safe as possible. Yeah.
yeah. And it's amazing how many bathrooms, even in hospitals, aren't fully accessible or as safe as they could be. So
Yeah, definitely. Now, I see the grab bars there. Can you give us
Mhm.
like a tip? Based on
Yeah.
the program here, there might be a lot of people who are very eager to,
yes,
there are things I could do by myself. I don't need Oakley Home Access. I could do it. I can get one of those suction cup type things,
Oh,
and
don't
put
do
them
that.
on the-
yeah, don't do it. No.
We are not at
Exactly.
all opposed to people finding simple things that, better lighting, removing any falling hazards or trip hazards, things that you can get on Amazon or even sometimes at CVS, the little touch lights that you can put going down your stairs or your hallway to the bathroom or things like that. But please, I'm looking into the camera. No matter what you do not use suction grab bars. Please don't. It will not end well. Anything else, feel free to ask a professional for advice and they should help you out of the goodness of their hearts and their professional ethics. No grab bars, no suction grab bars.
Great.
Other things can definitely, things that, don't use your stairs as storage. I've been in too many homes, as I'm sure Dan has as well, where people have a laundry basket or other items that they keep on their stairwell from first floor to second floor that are just much too easy to step on and fall or trip over and fall. There's lots and lots of common sense safety measures that any of us can do to make our home less of a fall hazard. If you notice when you step out your front door, sometimes that little metal, I don't know what the real word for it is. It's the thing that goes over the threshold, might be loose and you slide right off of it and you only went down one step, but your ankle.
Yeah.
Like keeping on top of small repairs and things like that turn into worse hazards for sure. But there are definitely lots of items that are available at Target or the Walmart pharmacy or CVS that make things just life a little easier, make your quality of life a little bit better. We have a popular item that looks like almost like a manual can opener. You've probably seen it, Debbie, but it's got a hook on one end. And if you open the front door of your car, you'll see that there's always the little D-shaped loop in there. Someone can put this hook and handle onto that loop and just use it to help them push themselves up out of the seat, especially if you're in a lower car like a sedan. For a lot of people, getting up from that lower seating position, like a lower toilet, is difficult. So that little object helps you push yourself up, and somebody's got your cane or your walker, or once you're up, you're okay to walk independently. But that just makes getting up out of that seated position easier. It's not a bad idea to look at those sections that are usually in front of the pharmacy at your big box store or at a drugstore or a small local pharmacy. Often will have a lot more of that kind of home equipment. And ask the pharmacist what to do. Ask your doctor, and they can usually point you towards some very simple. Don't stand on chairs to change a light bulb. I'll tell you that myself too.
Yeah, definitely.
Ask for help.
I purposefully mentioned the grab bar with the suction because that is just so
It's
not
just
good.
Should not be sold, should not be an option. If you weigh more than 20 pounds, you are going to pull that off the wall. So
It's not meant to hold up a body weight.
It is not.
Yeah, so please do not get those type of grab bars. So I was hoping to get a rise out of Dan, but I got the rise out of Norma.
I'm adamant about this.
Yeah.
No suction grab bars.
Norma
No.
beat me to the punch. I have too much trauma from the suction cup grab bars as an OT. Just a lot of conversations with people to install the durable grab bars. And sometimes the installation of those grab bars comes from a good place. They think they're doing the right thing. A lot of people think that this is great. I've known occupational therapists that have been okay with it at first because it's just knowledge, and sometimes people who can't find the resource to find somebody to put in a durable grab bar. And I think that's part of the problem is that not only not knowing what product is safe or unsafe, but not knowing the correct resources to try to facilitate something like that. Not many people just know where to go to find where we can get these grab bars put in. And like I said, there's a lot of companies out there, and there's family members that are skilled that can put in a durable grab bar.
Yeah, I want to add also a grab bar. It doesn't just belong in the bathroom, right? It can be anywhere that you need it, that you need a little bit of a hoist,
Stairways is great.
What's that?
Sometimes going up the stairs, a lot of homes, I'm not sure if it's up to code or not, but they don't have any kind of a banister, or there's one on one side, but not along the wall. And that may be where that person is more naturally going to stabilize themselves going up or down the stairs. So sometimes it's like a supplemental railing for outside or inside stairs. I know we're enjoying fairly nice weather so far this winter, but fall prevention in the winter is, a whole topic that you could probably do an hour on its own, but making sure that your access from your house to get in and out of your home when you do have to go out in bad weather is important too. So making sure that your front stairs, or if you have stairs inside your garage, that there's a handle or railing there for somebody to use for stability, that rock salt, whatever you use to keep things non-slip, making sure that somebody does come over and shovel when needed and things like that is also just really important. I know there's special ways that we're supposed to walk if we might be on an icy surface, but for somebody who uses a cane or a walker, it's a different story. So they've got to learn the right ways to handle the bad weather and slippery surfaces outside too.
Great, thank you. Anything else that you want to add, Dan? We're at the top of the hour, but is there any one last point that you want to kind of like really emphasize to the people out there, people who want to age in place? What is your main tip as an occupational therapist?
Great. So in this last one, I'd like to speak as an occupational therapist. So one of the most important things and most preventative things that somebody can do. So I don't know if anybody knows what orthostatic hypotension is. It's basically sometimes, and this could be across all age spectrums. This could happen to somebody who's my age. Getting up too quickly, and the blood doesn't get to the head quick enough, and people faint and they have falls. You don't know how many times I've been in the hospital and somebody says, well, I got up too fast. Some of the things that you can do, especially it happens a lot when you're lying in bed, is slow position changes, just going slow. Sometimes that's a tough thing for some people, but just taking your time, especially when you first get up nice and slow, take a deep breath, or stretch yourself out, take some slow steps, and then you don't know how many falls can be prevented just by slow position changes in the morning or after sitting for a long amount of time. And also drink water. Drink plenty of fluids. I think
very good point altogether. Orthostatic hypotension is very common, can make it's like a head rush. So anytime you're changing your position, try to do it gradually and kind of just stay there, maybe count to 10 slowly. So that way your body is acclimated to the new position. So, and then go ahead and move to the next, activity that you want to do slowly, and definitely avoid dehydration. So that way you don't get dizzy from that. I can't believe we're at the top of the hour. I want to thank Norma and Dan from Oakley Home Access for really sharing with us the world of home modification and what we could do to age in place.
We're so happy to be here and share the information and avoid those falls.
Yeah, definitely. Thank you so much, everybody. Thank you, Quincy Public Library, for allowing me to continue to do my work.